A couple of years ago, we would have understood under functional disorders that do not have a structural deficit. Today, we know that even in functional disorders, there might be an overlap with somatic diseases. So we are not doing this division between somatic diseases and functional diseases anymore, because we know and we acknowledge that there's a large overlap between these disorders. So today we would probably say functional disorders are disorders with persistent somatic symptoms that cause a lot of distress and for which at the moment there is no, let's say, clear treatable pathophysiology. I think it's important to know that there's a large overlap. For example, if you look, for example, at ulcerative colitis and irritable bowel syndrome, these are two different diseases. One is a clear inflammatory disease, the other one is a clear functional disease. But if you look at the symptoms, for example, they are pretty close. Can be problems with bowel movement, pain, abdominal pain. But there's also some in the pathophysiology, like minor inflammation, there is kind of an overlap. So I would know that even in patients with ulcerative colitis, there might be flares that correspond to irritable bowel syndrome. But of course, to do the diagnosis, I would of course look at the inflammatory parameters like fecal calprotectin in ulcerative colitis, which in flares must be very high. And for example, blood in the stools, which is a clear warning sign of ulcerative colitis and not irritable bowel syndrome. And so with I think with a lot of clinical science, you can differentiate between functional and somatic conditions. Also, the cause of the disease is different. For example, in irritable bowel syndrome, usually patients suffer from it for years. Yeah, it goes maybe a bit up and down, and there are periods which are better and periods which are worse. But overall, they're kind of a long-lasting disease. And with let's say clear-cut somatic diseases, usually they got worse, and they have not such a long course when firstly diagnosed. Functional disorders are diagnosed based on symptoms. And symptoms, of course, can be part of functional disorders. Yeah, they are, let's say, the core of functional disorders, but they can also be part of somatic diseases. So I would say based on the symptoms alone, it's probably difficult to differentiate. But if you look at the cause, then, let's say, of the symptoms, then it becomes a bit easier. But just if you have one symptom, let's say like abdominal pain, you cannot differentiate alone based on the symptoms. You need, of course, the physical examination, you need the history, and then you might be able to differentiate. It's very important that even in patients with functional disorders, you look and you exclude, of course, somatic diseases, because patients with functional disorders have the same risk of developing a somatic condition like other persons. So that's very important for diagnosis. Well, there are a lot of terms. Let's start perhaps with functional disorders. So usually, of course, it's a group we call functional somatic disorders, but there are a lot of specific functional disorders like irritable bowel syndrome, fibromyalgia, and others. And these have clear diagnostic criteria. For example, for irritable bowel syndrome, there are the so-called Rome 3 or 4 criteria. And these are criteria based on symptoms. And you look if the criteria are present or not, and then you can make a diagnosis of this specific functional disorders. While we do have a lot of terms like different functional disorders, we also have somatic symptom disorders, bodily distress disorder, and also persistent somatic symptoms. I think what is important, if you diagnose a functional somatic disorder, it does not mean that there's not a somatic symptom disorder. So it's always important to look at both conditions and to diagnose both or one of them in order to best describe the patient's problem. So if there's a patient with, let's say, irritable bowel syndrome, it's still important to look whether he or she also fulfilled the criteria of somatic symptom disorder or bodily distress disorder. Because if yes, then you might be able to provide him or her with additional treatment. For example, if somebody suffers, in addition to functional somatic disorders, from somatic symptom disorder, then, for example, psychotherapy might be important. I would not say you are not doing either or, either functional disorder or somatic disorder or mental disorder. You're trying to, it's always important to describe the patient, let's say, as comprehensive as possible. And sometimes you might need different diagnoses to best describe the patient. Well, I think what is an important topic that maybe with functional somatic disorders or persistent physical symptoms, especially if there are no clear reasons or no clear pathophysiology, that these patients are sometimes facing stigma in the society, but also in being treated, or maybe stigma by physicians or stigma by other patients. And this is of course a problem that we have to work on, because patients with functional disorders are suffering as much as patients with somatic diseases, and there's no difference, and there should not be a difference in legitimacy or let's say moral background of the suffering. It's important to just see the patient and his or her suffering, and not to stigmatize different reasons for the suffering.